Hello, my name is Aditi Apte. I work as Senior Medical Scientist with KEM Hospital Research Center, Pune. I am a medical pharmacologist by training and work in community-based research studies. Bioethics is one of my areas of interest. The title of my project is Empowering Women Participation in Rural Community-Based Clinical Studies. So autonomy of research participation is an important pillar of bioethics, and informed consent is an important tool in voluntary decision-making about participation in a research study. It is known from global data that women are more likely to get influenced by family, friends, and colleagues as compared to men. When it comes to women from rural areas, we know that there is low education status, financial dependence, and limited health literacy. But there is really scarce data on whether rural women can make their decisions about participation during the consenting process for a clinical study. So we set out to assess the enablers and barriers for rural women's participation in informed consent process as part of clinical study. I did this study in Zuna, Rambegaon and Khed blocks of Pune. These are rural areas where our field research unit practices. This is a qualitative exploratory study design. We conducted 13 in-depth interviews amongst young women who were part of our vaccine study, their family members, and also healthcare providers who were engaged in conducting the consent process, and field research assistants who were involved in the pre-study visits. There was good representation from diverse education and occupations in this study group. So what are the key outcomes? Comprehension and opportunity to ask questions. Although women had good comprehension and had opportunity to ask questions, few women ask questions. They often hesitate in front of their husbands, which is irrespective of the education status. Autonomy of decision-making. 80 to 90% women depend upon their husbands or father-in-laws. When they say they take their own decisions, they say that husbands have given permission to take independent decisions. Husbands at times are not confident about their wives' decision-making. Women sometimes initially agree and then withdraw because of opposition by in-laws or husbands. On the contrary, women from poor households are independent decision makers because probably what matters to them is a free treatment through the study. If there is a conflict in the family about decision making, about the study participation, then sometimes women try convincing husbands, but at times they leave the matter aside. So this is a quote from husband of a participant. She would not have been able to make a decision because we were together and I said yes. She said yes for the study. So these are some important factors which were found affect decision-making by the woman: education status, more importantly, financial independence, position of the woman in the family, years after marriage, exposure to the outside world, and involvement in healthcare workforce. This is a quote from a 4th grade educated woman participant. Since I have started working, I can see a change in myself and I can take my own decisions. When asked about consenting should be different for women, an opinion came that presence of a female physician can facilitate communication, especially when it comes to questions related to family planning. Women need to be encouraged to participate in the consenting process and ask more questions. And also they can ask better questions if they are alone in the consenting process. So these are insights from my project. There is definitely inadequate decision-making by rural women about study participation. Not only education, but financial independence is important in empowering women. Also, participation in health workforce can be a strong factor in decision-making. And the consenting process can be made more gender inclusive by encouraging women to ask questions, involving women physicians and nurses, and providing safe space during the consent. My journey in the WomenLift Health cohort has been authentic because the journey has provided me new insights into my strengths and weaknesses. I got an opportunity to delve into this important problem of reduced decision-making by rural women. It was inclusive because I could ally with community members, my colleagues, and also planning to do that with administration. It has definitely strengthened my voice as a woman leader. I find this strategic because I'm adding a gender lens to the important domain of bioethics, and I'm planning to take the findings of this project to my administration. This project will be a first step in making gender appropriate changes to the consenting process. And because we found financial independence is such an important factor empowering women, we plan to provide employment opportunities to the local women in our field research area through our research studies. I would like to end with this quote. Women don't need to find a voice. They have a voice, but they need to feel empowered to use it. And people need to be encouraged to listen. I would like to thank my mentors, my coaches, and the entire WomenLift team, WomenLift Health cohort members, and all my colleagues from KM Hospital Research Center. Thank you.